It's not something we talk about very often, but it affects a lot more people than you might think. We're talking about hearing loss. Dr. Tim Steele, an associated audiologist, is here with some information that's surprising. Tim, thanks for joining us this morning.
Thanks
so
for
glad you're
having me,
here.
Lisa.
This was surprising to me when we talked because hearing loss is something we think of our grandparents, and we think it's an older people's condition.
Right.
That's not the case at all.
Right. There's a lot of stigmas, I think, about hearing loss being associated with age, and although that is true, 2/3 of people with hearing loss are under 65. So it affects all ages.
That's unbelievable. And the numbers are higher than we would think of people with hearing loss.
I think because hearing loss is invisible, where you don't see it right in front of you. So actually the estimates in the U.S. population are that 17 million adults in the United States have some form of hearing loss. So it's significant. 17%, sorry, about 36 million.
That is a lot of people, and it affects children, which we've never really given a lot of thought to.
It's one of the reasons why we have newborn hearing screenings, because it's one of the most common birth defects. So we can catch it early, and intervention early, of course, is very important for normal outcomes.
And it is the third most diagnosed health problem out there.
If you look among some of the common occurring health conditions in adults, there's hypertension, heart disease, diabetes, and hearing loss. So it's, again, a big kind of chronic health problem.
And there are a lot of signs to look out for if you think you do have hearing loss.
Usually it's other people that notice it, and you might have somebody in your own life that exhibits some of these symptoms. Of course, listening is different than hearing, so we always have to kind of pull those two things apart. But common signs would be asking for repetition, having difficulty hearing in backgrounds of noise or groups of people, and maybe others telling you that the TV or radio is up louder than it should be.
And you say talking in groups. You have and restaurants.
Right, restaurants, groups of people, where there's maybe background noise. A conversation like you and I are having might become a little more difficult or strained.
And I'm amazed at how far the technology has come. I mean, again, we think of our grandfather and the big clunky hearing aid. Not so anymore. You don't even have to see them. Right.
I think that's another stigma we'd kind of like to break. I think we do think back to our grandparents or other people in our lives that wore hearing aids that were large and noticeable. And I think it's common to have that kind of concern. Well, how is this going to look? And now we have discrete options. I brought in a few that we were talking about. We have very tiny devices that can fit deep in the ear canal. We have some very tiny devices that could actually fit behind the ear with a little piece that goes down in. And I think, a lot of people are concerned about how a hearing aid will look, and although I'm very sensitive to that, what they don't realize is that hearing loss itself can be obvious if you don't answer correctly or answer wrong or don't respond at all. You can't hide it.
You can't even see these.
Yeah. Oh, yeah.
I mean, this is great. And a typical hearing exam is pretty easy and pain-free.
Right. Yeah. A good diagnostic examination of your hearing is kind of the baseline, kind of a blueprint that we recommend for everyone, and especially if you're having these concerns with hearing. And that appointment can take 35 minutes for a good hearing test. And
we're going to have you back from time to time to talk about even more technology that's out there that's very exciting, things you can do in your home. Dr. Tim Steele, thanks so much. Associated Audiologist has several locations in the metro: the Shawnee Mission Medical Campus, Overland Park and Prairie Village, and Leavenworth. You can also check them out online at hearingyourbest.com.